My name is Paul Offit. I'm talking to you today from the Vaccine Education Center at the Children's Hospital of Philadelphia. It's Thursday, January 29th, 2026. Now, Robert F. Kennedy Jr. was confirmed as Secretary of Health and Human Services in February of 2025. 2 months later, in April of 2025, he made a startling announcement. He said he was going to bring the full forces, the full resource forces of the National Institutes of Health and the Centers for Disease Control and Prevention to find out the cause of autism. He said it was environmental, it wasn't genetic, and more importantly, by September, he would have the answer. He would know the cause of autism. Sure enough, in September of 2025, 5 months later, at a major press conference attended by President Trump, him, Dr. Marty Makary, who's the head of, or the commissioner of the Food and Drug Administration, and Jay Bhattacharya, who's the head of the National Institutes of Health, had this major press conference. The first to speak was President Trump, and he got up and really, in the manner of a game show host, gave the big reveal. Now we were going to know what the cause of autism was. He said it was Tylenol. Tylenol taken in the first trimester of pregnancy, which is used probably half the women in this world, taken to relieve pain, taken to decrease fever, was the cause of autism. And women needed to tough it out if they had pain, tough it out if they had fever, and avoid taking Tylenol. And with that, they would decrease the incidence of autism. Robert F. Kennedy Jr. stepped up right behind him and said that the FDA would now have a label change on Tylenol to make sure that people were aware of this problem. Now, to back himself up, Robert F. Kennedy Jr. held up 27 studies that, according to him, proved that Tylenol, when taken in the first trimester, caused autism. Now, if you looked at those studies, they were all critically methodologically flawed because they didn't have the right controls. The way that you control for Tylenol intake is you look at moms who took Tylenol in the first trimester for one child, but didn't take it for another child. That's the best comparison because it controls for maternal health, it controls for maternal genetics, and it controls for socioeconomic background. When those studies were done, and there was a study done at the time in Sweden that involved about 186,000 children with sibling controls that showed you were no greater risk of having autism if your mother took Tylenol in the first trimester or if she didn't. Again, looking at comparing siblings. Similarly, there was a study in Japan of 200,000 children doing the sibling controls, again showing no increased incidence of autism when in the sibling whose mom had taken Tylenol in the first trimester as compared to a sibling whose mom hadn't taken Tylenol in the first trimester. Now, the reason I'm talking to you today is that about a week ago, there was a paper published in the Lancet that looked at a review of 17 different studies that all used sibling controls, and all of them found the same thing, that there was no increased incidence of autism when the mom took Tylenol in the first trimester or if she didn't take Tylenol in the first trimester. So, case closed. I think if this world were fair, that Robert F. Kennedy Jr. would stand back up again at the microphone and say he was wrong, because he unnecessarily scared mothers about taking Tylenol to relieve their pain or relieve their fever. And I think worse, he basically was blaming mothers for their child's autism, which sort of takes us back to the old days of people like Bruno Bettelheim, a psychiatrist who said that the reason that autism occurred was that mothers were distant, cold, the so-called refrigerator mothers, which was also unfair and also incorrect. So I think mothers should be reassured that taking Tylenol in the first trimester does not in any way increase the incidence of autism. And to the credit of the American College of Obstetricians and Gynecologists, they immediately stepped up the day that announcement was made to say, no, don't listen to this. It's wrong. The studies don't support it. So thank you for your attention.